Thanks very much. So why are we all here today? So hopefully you're here because you want to learn how to get your community specialist consult reports on Netcare. And the way we're going to do that is through a technology called Community Information Integration, or CII. So the webinar today is directed for specialist clinic managers or clinic managers that have primary and specialty in their clinics. And we're hoping you're going to learn lots and want to help get specialist consult reports on Netcare. Next slide, please. So who's talking with you today? So it is myself, Jillian Bates. There's my email there as well. Also Barb McCaffrey, who you saw at the beginning, you'll see again soon presenting, who is the CII-CPAR project lead, and I am the lead for community specialist. Both our personal emails are up there, as well as we can both be reached at CII-specialty@albertadoctors.org. Both Barb and I work for the Alberta Medical Association. We work in a department called the Accelerating Change Transformation Team. And we're here to bring this information to you on CII, and we'll talk a little bit about the many partners that are involved in this technology to support getting consult reports on Netcare. Next slide, please. So what are we going to cover today? We only have 55 minutes. We're going to cover quite a bit, fairly high level, but please know we're available for questions, and we have lots of other resources that you can access after today. So we're going to talk about why would you want your consult reports on Netcare? What are CII and CPAR? And I'm already using terrible acronyms, and we'll get to what those actually mean. How does it work? What is the current progress in the province of Alberta? What are the prerequisites to join CII and have those consult reports go to Netcare? What is the role of a clinic manager in this whole process? And where you can get more information. And as I mentioned, we're hoping to have at least a good 20 minutes at the end for Q&A. We can answer any of the questions you've put in the chat along, as well as further questions at the end. Next slide, please. So we're here to talk about technology, but the technology is to support an integrated healthcare system and continuity for care for patients. Next slide, please, Barb. We wanted to start today with a story. This is Dr. Steve Tilley. He's a cardiologist in Red Deer, Alberta. He works at Red Deer Regional Hospital as a staff cardiologist, but he also has his own private clinic called the Healthy Hearts Institute. And we have a recording of Steve who's going to share to you a particular patient story where one of his patients that he saw in his community clinic had their consult report on Netcare and how that made such a huge impact for a patient and providers. Barb, can you please play the audio?
CII has had an enormous impact in my practice. We have a community practice with cardiologists, and here in Red Deer, Alberta, we deliver consultation, follow-ups, and stress tests out of our office. And those reports, prior to CII, would sort of just go out into the ether. They go back, a copy would go back to the family doctor, but there'd be no copies anywhere on Alberta Netcare, and if a patient went into the emergency department, they would not be available. So we implemented CII probably last fall, and it's been a tremendous help. We have had a patient in particular from one of the rural communities here in central Alberta who was referred by his family doctor to see me in the office for, I think it was exertional shortness of breath. The patient had had a workup at the office, found to have severe aortic stenosis, was further worked up, and I attended the conference call when you figure out how to fix someone's valve, where you figure out what the game plan is to fix someone's valve. And the plan was, after discussion, the patient would have a TAVI valve. That's a valve that's fixed through a less invasive procedure through your leg, as opposed to doing an open heart surgery. So that was the plan for this patient, and the patient came to see me in follow-up, and we documented that was the plan, and it was going to take 3 to 6 months to get done. So that was fine, and the patient went home. Now, several weeks or maybe a month or two later, the patient ended up back in a rural emergency department with complaining of acute onset shortness of breath, and in fact it was in pulmonary edema. So this patient then, the family doctor or the doctor that was covering the emergency department in this rural hospital, then just went in and went into neck care, looked up the patient's information, and then saw the consultation and saw the follow-up note that said the plan was, the diagnosis was aortic stenosis, and the plan was to have a TAVI valve in 3 to 6 months. Then using that information, then they were able to quickly figure out what to do for that patient, that then and there, and moreover, they were able to contact me in Red Deer, and we were able to get that patient transferred in. And from there, we sort of optimized the patient medically, then contacted the facility in, I believe it was Edmonton, to get that valve procedure expedited. So then the patient, shortly thereafter had that valve fixed and is now doing fine. The advantage that this had in this scenario was if the emergency doctor in this rural community didn't have that patient's information on neck care, and nowhere else on neck care was that information documented, that the plan was to have a TAVI valve and the wait time was going to be 3 to 6 months, etc. If the doctor didn't have that information, then it would have not been quite as smooth. The doctor may have been able to reconnect the dots, and likely would have in due course. However, the question is would the patient have been really managed as quickly, and how many more hospital bed days would have been consumed? And would the patient outcome have been as good? I mean, part of the situation is when you have someone who's deteriorating, is that really we need to get moving on them. And the fact that everything was able to happen quickly because we had a good sharing of information was particularly important. So I think there's unequivocal benefit of CII for this particular patient and to many of my patients and patients in my practice here in Central Alberta. So certainly thanks to AMA and to I guess Alberta Health for organizing this and making CII happen, because it's certainly a very useful tool.
Thanks, Barb. So hopefully you can all relate to that story. Now, I know we don't all, we're not cardiologists, or do we work with cardiology, but I'm sure you have lots of examples where if somebody in your patient's circle of care had access to the consult report, it would have benefited the patient and it would have benefited the other providers. So Steve's is sort of the extreme example of somebody going to emerge with severe cardiac issues, but you can see how much of an impact that could make for that patient and those providers in their care and their ability to deliver the best care they want, and the cost effectiveness of the care, and certainly the outcome of that patient. So please reflect on that story as we move forward and we learn about this technology that can help support that. Next slide, please. So what are CII and CPAR? So besides two acronyms that are going to be ingrained in your head. So CII is Community Information Integration, and CPAR is Central Patient Attachment Registry. And these two pieces go together. Next slide, please, Barb. So Community Information Integration, or CII, which you're most likely going to hear me say most of the rest of today, is a system that collects select patient information from community electronic medical records, and through the CII hub shares it with other members of the patient's healthcare team that have access to Alberta Net Care. Some information is also shared through in a healthcare data repository, which is a provincial repository governed by the Health Information Data Governance Committee. Next slide, please, Barb. The other piece of technology is the Central Patient Attachment Registry. We're not going to get into that very much today. This is a provincial system that captures the confirmed relationship between a primary provider and their panel of patients. And for those not familiar with the concept of a panel of patients, this is a group of patients normally with a primary provider, so a primary care physician or a nurse practitioner, and in lots of situations also pediatricians. It is the provider and team that's responsible for providing comprehensive and longitudinal care for a particular patient. And this piece of technology records who has that relationship with the patient. It is a system that also is electronic and automatic, and it receives information from community EMRs about that relationship and uses CII to share that with other parts of the healthcare system. If you would like more information on CPAR and you work with primary care providers and you work with pediatricians that have panels, certainly take down Barb's and my email, or you can use that CII specialty at albertadoctors.org email, and we can get you more information on that. Next slide, please. So how did these two pieces of technology come about? The Central Patient Attachment Registry was at the request of family physicians, so the section of family medicine. At the time in 2016, it was the section of general practice. They asked for this technology to record that really important relationship about who is responsible for the comprehensive and longitudinal care of patients. So the commitment was built to build that technology for primary care. Following that, Alberta's community specialists also made the request for technology to be able to submit their consult reports onto Netcare, and that is through CII. And that request was made through the Alberta Medical Association Specialist Representative Forum. The technology in the project was built through many partners. So the partners involved in this initiative include the Alberta Medical Association, Primary Care Networks, Alberta Health, and Alberta Health Services. Next, please. So how do these pieces of technology actually work? Next. So we're talking mostly just for what is relevant for community specialists and people without panels. So from your community EMR, there's two pieces of information that can go forward through the CII Data Hub. And those pieces of information, one is called clinical encounters, and the second is specialist consult reports, and we'll get into more detail about how that works. So they do go through the CII Data Hub, and then they are available onto Alberta Netcare, as well as some data goes through to the healthcare data repository. Next, Barb. As I mentioned earlier, for providers with panels, so primary care providers, nurse practitioners, and some pediatricians, the patient panel information moves this way as well, moves through from the community EMR through CII through to the Central Patient Attachment Registry. But that's pretty much all you're going to hear about the rest of that today. Next slide, please. So there's different pieces of information that can move forward. So for community specialists, encounters is optional. So encounters is pretty close to the same as a visit. So it's information about a visit. But when you sign up for CII, the big interesting, exciting thing going forward is your consult reports being available on Netcare. And then for physicians and nurse practitioners and allied healthcare teams, they can have encounters, and some of them write consult reports as well. So if they write consult reports, those also can go forward. And then, as mentioned previously, family physicians also have the addition of panel information going. Next, please. So this graphic is hopefully pretty easy to understand, but the technology, it works a little bit different in each EMR, and we can provide you specific information on how it works in the EMR in your office. But it can take the consult report through to the data hub. It makes it into essentially a PDF and shows up in Alberta Netcare, making it available to anyone in that patient circle of care. Next, please. And in Netcare, this is where it shows up. It shows up in the existing consultation folder. And when you hover over it, on the right there is an image of what you might see, so that anybody in Netcare can now see your community provider consult reports, which is exciting for lots of specialists, especially those that have worked in AHS and community facilities where only they had half their consult reports on. Now they can all be on, and people that only work in the community now can participate and have information available in Netcare as well. Next slide, please. So here's an image of MedAccess EMR. So these aren't all the detailed instructions. There's a few more instructions to how to make it happen, but the important note here at the bottom is that the provider has control over whether a consult report goes to Netcare or not. The very bottom of the screen there, all they have to do once they're signed up for CII and they have been enabled, they just need to click that little box and say, yep, please send this consult report to Netcare, which allows them to have control to only send the ones they want to go. So if they feel like something's confidential or not appropriate to go to Netcare, they don't have to check that box. And there also is the functionality to unsend reports if you don't want it in Netcare and you accidentally sent it in the first place. Next, please. So the second type of information, in addition to what we were just talking about consult reports going, is something called encounter information. Now this participation in this part is optional. We're hoping you see the benefits in it of participating in this part as well. Next slide, please, Barb. So encounter information is select data from defined fields in your EMR. So we have lots of images and guides we can send you. It's only very select, a few discrete fields that go forward through CII Data Hub, and it creates something called a Community Encounter Digest report. And we'll look at that in a little bit more detail. And some of the data goes to the Healthcare Data Repository, which allows for provincial program planning and quality improvement. So let's take a look at what some of those fields are that are in this Community Encounter Digest report. So this Community Encounter Digest report is also available in NetCare for anyone in the circle of care. And it generally contains some high-level visit information. So it allows providers, for instance, in the emergency department or even family doctors, to have a quick snapshot of what visits did that patient have in the last 12 months, who have they seen, and what have they seen them for. So some of the information, I realize you won't be able to read this document on here, but we can send you samples. But in the bluey green color is the community encounter information, such as dates and locations, who they saw, a very brief discrete fields on health concern history, possible allergies. They're not absolute allergies. This is just possible allergies on here. A few measured observations just from very defined fields that you'll see there, as well as referral requests that have been made. And we're hoping with that there, they'll stop being referral requests to multiple specialists of the same type, and people will have a good sense of when patients already been referred. There's immunization information available if there's an immunization given at the visit. And at the very bottom is a disclosure statement, and it's the same disclosure statement that is on all NetCare documents, that this information is live at the time and that the provider must confirm that information is necessary. So this is just a 12-month rolling snapshot to help direct people where to go get more information. So there are confidentiality features in each of the EMRs. And again, when you're ready to sign up for CII, we're happy to show you how it works in your particular EMR, but please know the provider is in control of what information goes to NetCare. It can be automatic, but if they would like to stop certain things from going, we can show how that functionality works. Next, please. So what is the current progress in Alberta? So we've had a lot of uptake in primary care, and we're now focusing more on specialists. There have been some specialists that have been great involved in sort of the early limited production rollout, but we're really ready now to ramp it up, and we're happy to have any specialist in the community involved that wants to be involved. Right now, very exciting, there's almost 47,000 consult reports in NetCare that have been uploaded from community specialists participating in CII. So that's pretty exciting if you think of how many patients that can now support their care. Next, please. So we've had the privilege of working with a number of different clinics, and this is a quote from one of the early adopters of CII. And their at Alberta Derma Surgery Center's team has said that the ability to upload consult reports has been invaluable, especially the ability for physicians to have access to consults done in private clinics. Our consult dermatology patients who come from ED referrals can now have their consults uploaded to NetCare. It's a real time saver. So I'm pretty sure some of you have experience with family doctors don't even know when their patients have gone to emerge and had a referral to a specialist, nor do they know to go look for the consult. CII helps make that information more available to everybody in that patient's healthcare team. Next, please. Now I'm going to hand it over to Barb, who's going to talk to you a little bit more about some of the prerequisites about how to get on CII.
Thanks, Jillian. So if you are interested, there are 3 prerequisites for a clinic participating in community information integration. The first prerequisite is that the clinic must be live on Alberta NetCare portal. And we know that most clinics in Alberta are live. The second requirement is that the clinic EMR privacy impact assessment must be current or up to date. And I'll talk a bit more about that. And then there are 3 conformed EMR vendors with 5 EMRs. Those are MicroQuest HealthQuest, QHR Accuro, and the TELUS 3 of MedAccess, PS Suite, and Wolf. If a clinic is on a local install of MicroQuest, HealthQuest, and QHR, they will be transitioned over to the most up-to-date version of those EMRs if they're not on the most updated version. We do get quite a few questions about privacy. And before I go into the PIA, I'll talk about privacy in the project. Importantly, CII is under the same umbrella as Netcare according to the Health Information Act. So under the Health Information Act, providers don't have to have direct conversations with their patients about participating. What they do have to do is post a health collection notice poster in the clinic to inform patients of their participation. There is some ability to be flexible on this as well, that if a clinic has a registration process, they can inform patients there or through their website as well. If patients have questions, there is a patient brochure. We have created a script for the physician and team to use if they do want to discuss this with patients. There is an FAQ document available for Albertans. And finally, there is a privacy and security FAQ so that people can understand that this information is stored and as secure as the other information that sits on Alberta Netcare. Importantly, though, you might be asking, what do Albertans think? And before the project began, AlbertaPatients.ca did survey a large group of Albertans, and there were 2 interesting findings. One is that most Albertans already think that care providers in Alberta already have access to some or all of the records. So in other words, Albertans think there's more sharing than actually going on. So they're ahead of where we actually are. They were offered a detailed description of community information integration, and most Albertans did approve, which actually this high number of 93% came back from the surveyors as quite remarkable. And of course, some of those Albertans did have reasonable concerns about that. And those were about access, security, and consent. Also, the Health Quality Council has surveyed our participants, and they're finding that Albertans are not asking doctors about this when they see the posters in their exam rooms or clinics. They might ask a few questions about Netcare, but there's been very few questions about CII. So the next thing we're going to look at is, as you're an audience of clinic managers, what is important for clinic managers to know? So first of all, we do ask when a clinic is engaged in this. There's a lot of one-time processes that occur at the beginning. And we ask an individual at the clinic to be the point person, which we call the site liaison. And more often than not, for a clinic that has a clinic manager, it is the clinic manager. And they do quite a bit of coordination at the beginning about the readiness, Netcare, privacy impact assessment, and just confirming what EMR version they're on. They will be completing some forms at the beginning, starting with the confirmation of participation form, a lot of awareness that has to occur at the clinic, including training on things like the confidentiality feature in the EMR. They will go back and forth with eHealth support services on data quality before go live. They support issue management, and they will coordinate the evaluation that is optional for the clinic to participate in at the end. So this is what the journey looks like for a clinic participating in community information integration. Starting right now, if you consider this engagement and interest, there's registration, onboarding, go live, a little bit of process improvement if it's needed in the clinic, and then post-implementation evaluation. During the engagement and interest phase, we would expect that many clinic managers would play the role of sharing information in the clinic about CII, mapping if they want somebody in the clinic to participate in contributing encounters. And by the way, that doesn't have to be a physician. We have non-physician participants. We might have a specialist clinic that, let's say, offers cardiology care, and the cardiologists are contributing their consult reports, but they have a dietitian in the clinic, and the dietitian is contributing encounters. So that is an option for the clinic. The clinic manager would likely work with physicians to make the decision to participate and identify the site liaison, especially if it's themselves or somebody else for the project. The next step is some forms, and that would start with the confirmation of participation form. And we do recommend that at this point, the clinic complete a privacy impact assessment, self-assessment, to determine where the PIA is at before you move ahead. It's a recommendation, and actually it is a time saver in the long run if it is done at this stage. Once that confirmation of participation form is submitted, it triggers a whole new process. The first thing that happens is eHealth Support Services, this is the same as the NetCare team, confirms receipt of that. They'll also connect the site liaison to an eHealth privacy specialist. And they're going to connect with the clinic to talk about the privacy impact assessment and the risk level associated in that PIA. It does help if the PIA update self-assessment is completed before that visit and they're able to show the consultant their PIA, because then they can provide quite a bit of guidance and recommendations on next steps. Now, depending on the results of that PIA assessment with the privacy consultant at eHealth, there are 3 possible outcomes. The clinic could be up to date, be low risk, or their PIA might be higher risk. What does that mean to the clinic? If it's up to date, they move ahead right away. If it's low risk, they're provided some guidance and asked to complete those minor updates, but they can go ahead and participate in CII, and they are told to complete that update and submit to the OIPC within 12 months. If the clinic is higher risk, they're again provided some feedback, but told to update their PIA and then be copied at eHealth when it is submitted, because then they can begin right away with their CII implementation. At the stage of registration participation, they do get a participation package back from eHealth as they move ahead with a checklist of what the steps are that allow them to move ahead. The next step is called onboarding. And at this stage, they are confirming a go live date with their eHealth consultant. And they should be understanding what steps need to be taken in the EMR at this point and getting ready for go live. Now, go live day occurs on a mutually agreed upon date. And at that date, you want to make sure that the posters up are in the clinic. And there is some quality assurance processes that go on between the clinic and eHealth Support Services to ensure that the consult reports are displaying in NetCare as expected. And if the provider or a team member is submitting those encounter data, that those are flowing as well to the Community Encounter Digest in NetCare. After go live, there is an opportunity for some quality improvement if it's appropriate at the clinic. And we have had some clinics look at their processes. Even though there is minimal impact on workflow, they might be deciding who is clicking that send to NetCare button and ensuring that the whole team member that touches consult reports is on the same page associated with that. Sometime about 2 to 4 weeks after go live, an evaluation is sent to the clinic, again to this point person, and it is optional. But that is a way to provide some feedback on the process as well. So this is a bird's eye view of that journey to implement, and it begins with awareness and understanding how the EMR works, as well as like the confidentiality features in the EMR and the controls that the clinic has to contain information in the clinic with their EMR. There's that whole registration process over which the privacy and security compliance is done. Consult reports get uploaded to NetCare. There's a testing process there before a clinic is finally live, and then that optional evaluation. For clinics just implementing community information integration, the approximate time commitment actually isn't quite extensive. It's been about an hour for a specialist clinic. Again, big dependency there would be on where the PIA is at. Overall, how long does it take end to end? And we've had clinics as short as around 3 weeks to go through the whole process, or closer to 3 months. And the dependency is often on how fast the forms get filled out. Where the PIA at is another key factor. So we do have a specialist webpage for community information integration. It's on the website. We did provide some links in the chat, and that is a place that you can go to for information. And we have a special email contact for specialty clinics called CII-specialty@albertadoctors.org. And we have some more resources that are coming that are very specifically designed for specialty clinics. I do want to point out, though, at this point, you might be interested in how this looks in your EMR. And there is an EMR guide for all of the 5 EMRs posted on that website we just gave you for the TELUS 3 and MicroQuest and QHR that describes not only how it works, but the configuration steps that have to happen one time at the beginning, and how to keep information confidential in each of the EMRs. We have a specialist toolkit we're posting to the website very shortly that will help you as well as an end-to-end resource on what this looks like. But in all, we've had very positive responses from clinics that are participating, both specialists uploading their consult reports, and there are allied health providers as well uploading encounters, although that is an option for the specialists too. And they are pleased with this. For a long time, physicians and specialist community clinics have wanted to upload their consult reports to Netcare. They get the value. This makes it easy to do so. It is a free service. There's no cost to the clinic to participate. And as a result, they can save some workflow issues in the long run. This example from Advanced Cardiology Clinic, they aren't refaxing when a clinic calls back 3 months later for a copy of the consult report. They say, no, we faxed you a copy and it sits on Netcare, and that's where you can get access to it. So if you are ready to participate, we have the website and an email that you can contact, and we are open to taking questions at this time. I am going to pause the recording here.